Resuming debate. Reprise de débat. The honourable member for South Okanagan, West Kootenay.
Well, thank you, Madam Speaker, and I'm happy and proud as a New Democrat to speak today to our motion on the need and the great opportunity for a National Pharmacare Program that would provide free access to prescription drugs for every Canadian. And just as I'm proud to stand up for that belief, Canadians are proud of their healthcare system. It's something that defines us as Canadians. We don't think that healthcare is something that should only be available to those who can afford it. When Tommy Douglas brought the concept of universal healthcare to Canada, it was always intended to include the cost of necessary medicines. But unfortunately, this was not implemented when universal healthcare came into effect in Canada. And now Canada is the only country in the world with a universal healthcare plan that does not include the cost of drugs in its coverage. How can we consider our system to be universal if it excludes the very drugs that bring us back to health and indeed save our lives? So we have the nonsensical situation where I can go to my doctor and get my cut foot stitched up at no cost, but then have to go out and pay for the antibiotics necessary in that situation. And if I can't afford to pay for that prescription, I may well end up at the emergency room, needing the free medications that I get in hospital. It doesn't make any sense. And that added pressure on our healthcare system adds cost to all levels of government. The Canadian Centre for Policy Alternatives estimated that about 6% of hospital admissions are the result of people not filling their prescriptions, not taking their medicine. And that results in an annual cost as high as $1.63 billion across the country. To say nothing of the loss of quality of life for those people who try to get by without proper medication, who end up housebound or bedridden because of that inaction. And this is a clear case of how unfair our present system is. Why should people with the financial means to buy their medications be afforded better health care than those who cannot afford them? Now, in the debate today, I've heard several members ask, where are we going to get the $20 billion to fund pharmacare in Canada? Who will pay for those medications? Well, Madam Speaker, we will all pay, just as we do now. The good news is that if we had a universal pharmacare plan, we would be paying at least $4 billion less than we do now, according to the report produced by the Parliamentary Budget Officer last week. And that's a highly conservative estimate. The savings could be as much as $11.5 billion, as reported by other very credible studies. Now, let me repeat that. We could have a universal pharmacare plan in Canada where everybody is covered, everybody gets free medications, and end up paying billions and billions of dollars less every year. So, getting back to the question of who pays for our present system, the answer is individuals, businesses, government. The Conservatives are always talking about the effects of payroll taxes on small businesses across the country. Now, extended health benefits that include prescription payments are one of those payroll taxes, and one of the most expensive ones, and the costs are rising steadily for Canadian businesses because of that. And I'll add here, I think it's perhaps just a little hypocritical of members here to denounce a national pharmacare plan when their own medications, our own medications, are already paid for by the people of Canada. Like many Canadians with good jobs, we here in the House of Commons have most of our drug costs covered by private insurance paid for by our employer. I was covered by a similar plan under my previous employer before I was elected, but millions of Canadians lack that coverage. Also, like many Canadians, I take cholesterol-reducing medication to reduce the chance that I will have a serious heart attack or stroke. If I had to pay for that medicine myself, it would cost me well over $100 a year. If I was still self-employed, I would probably choose not to take that drug, putting myself at risk, risking higher costs for our healthcare system. Now, one of the interesting facts about that medication that I take is that Canadians pay an extraordinarily high price for it. Elsewhere in the world, in countries that have universal pharmacare and the strength of negotiating fair prices with pharmaceutical companies, that drug is much cheaper. In New Zealand, they only pay 1/10 of the amount for that cholesterol-reducing drug that we do in Canada. And this is true across the board for most medicines we use in Canada. We pay more for drugs than in almost every country of the world. And that could be fixed through a national pharmacare system with central purchasing for a powerful negotiating position with drug companies. Today, we've heard many examples of Canadians who can't afford to pay for their medicines and the negative effect that has on them and the costs that incurs on the healthcare system across the country. I'll mention just one more example. One of my constituents is a veteran who uses medical cannabis to treat his severe PTSD. Veterans Affairs has covered the cost of that prescription, which has allowed him to have a relatively normal life for the past few years. And this coverage has helped hundreds of other vets across the country, keeping them off dangerous opioids and away from the destructive use of alcohol. Recently, Veterans Affairs cut back on that coverage. This has forced my constituent and many like him to endure the painful effects of PTSD once again, and some have repeatedly ended up in emergency rooms in hospitals. The costs of those visits, especially when compared to the small savings from the cutbacks in coverage, are astronomical. Now, the report of the Parliamentary Budget Officer is clear. Our present system that separates the cost of prescription medicines from other health costs doesn't make any sense. It doesn't make sense from the perspective of keeping Canadians healthy, and it doesn't make sense in terms of how much money we spend on our health care. Universal pharmacare is sound economic policy. And if you don't believe the PBO, you can listen to the Heart and Stroke Foundation of Canada. It's time for Canada to fill a gap, and this is a quote directly from them, to fill a gap in our healthcare system and truly provide universal health care for all. The Heart and Stroke Foundation believes in the values of universality, equity, and equality in our healthcare system. All people living in Canada should have equitable and timely access to necessary prescription medications based on the best possible health outcomes rather than their ability to pay, close quote. Or the Canadian Diabetes Association, who believes that, quote, the universal access to necessary drugs is critical to the health of Canadians and a sustainable healthcare system in Canada, unquote. Madam Speaker, universal pharmacare will save Canadians billions of dollars. Everyone in this House should be happy to hear that. It will save individual Canadians money, and it will mean significant savings for business owners across the country. It will also relieve pressure on our healthcare system, saving billions of dollars there as well, and it would keep us all healthier. This motion simply asks the government to begin talks with the provinces about how a universal pharmacare program could be structured in Canada. It gives the government a whole year to organize those talks. Now, the government side says the time is not right for this. Well, we've all heard the saying that the best time to plant a tree was 50 years ago, and that the second best time is today. You know, we should have included pharmacare in our healthcare system 50 years ago, but we have the opportunity to make that bold step today. Thank you.